Good morning, Zimbabwe, and welcome once again to Zimbabwe Daily. My name is Yvonne Muchaka, and welcome to Level 4 National Lockdown Day 25. Today, we mark the 25th day since the people have been in lockdown. Today is 29 January 2021. And on the program today, I've invited Dr. Peter Mataruse. He's a practitioner from Chinhoyi, and I just want him to highlight a few scientific issues around COVID-19 that we need to have a better understanding on, so that as we do our lives, as we go on our daily progresses and daily work, we are able to keep ourselves safe and also to keep our families and our society safe. Dr. Mataruse, welcome to Zimbabwe Daily.
Welcome, thank you.
Thank you so much for taking time out of your busy schedule just to help us unpack where we are. Maybe you can start by telling me what you have found as medical practitioners about COVID-19.
Okay, allow me to start and to define it. What exactly it is the virus?
Yes, sir.
Yes, sir. The coronavirus is actually an RNA virus, which has got a lipid capsule and has got spikes on it, and there are several of them. They normally cause a flu like a common cold or flu like symptoms and some respiratory problems. And there are several which are available at the moment. We have got the Middle East coronavirus, which is MERS virus, which causes severe respiratory syndrome in the Middle East. It is still active, and it has been also discovered in Korea. This year, I'm sure they picked about 225. And then we have got the SARS COVID-1, which started in 2016 in Korea and then in China, and then we have got the Spanish flu and long backward influenza. All these are coronaviruses. At the moment, we have got the COVID-19 virus, which started, it was noticed first in China. And so far, researchers have shown that it has undergo several changes, mutations. In India, they say there are about 11 subtypes, but one is the dominant one, which is really very infectious. But other researchers have noted that by February, there was already a mutant present, which they called D614G. These are terms which we use in when we code the genetic coding in genetics. And then February, they already had another variant, and in June they have another one. In December, there are 2 cases. All of these ones, they are the same literally. They don't affect any changes in the diagnosis, except the last one, the one which they discovered on the 30th of December. It's a bit different from others. So that one might end up giving us more problems than the original COVID-19. So you can see this virus changes very quickly, it mutates very quickly. So we anticipate that problems we'll get from this virus are going to be very bad. And actually, the condition presents as flu, and it worse condition, majority of them just present as common cold, but others then develop severe symptoms, respiratory symptoms, with shortness of breath, a very high temperature, they lose appetite, they lose sense of smell, some develop vomit and others develop diarrhea. And treatment is according to the symptoms. We find supportive treatment mainly because there's no cure completely for this particular disease at the moment. So treat them as just simple common cold if they present with minor flu-like symptoms. If they develop respiratory symptoms, you give them oxygen. You can give them a ventilator support if it's severe. And if they develop pneumonia, you can add an antibiotic to assist them. And there's no really protocol at the moment. Yes, even in our country, there's no proper guidelines for the treatment of it. There are researchers now, and the ministry also in our case have actually recognized ivermectin, but there's no proof that it's going to be effective to Zimbabwe. So the ministry is now researching on it, but they have allowed people who want it to have access from our pharmacists and others. FDA, they have approved some antiviral agents like the remedies, which actually assist, but the others like hydroxychloroquine, they have been recalled. They are no longer using it. It has been shown not to be effective. So treatment is not very, very clear. The hope lies now in the vaccines. There are several of them. We have the one produced by Pfizer, one by AstraZeneca from the UK. All these vaccines, they are said to be effective, but for us in Zimbabwe, at the moment, it's just a talk. There's no clear cut evidence that we have planned to have this vaccine in Zimbabwe. But that is the hope we have in Zimbabwe, that if that virus, whatever is available, should come, at least vaccinate our people, starting with the health workers, the elderly, and those with comorbidities. That is the hope we have at the moment. Roughly, that is what we can say.
All right, Dr. Mataruse, thank you so much for that quick update on where we are and what it is that we are finding ourselves in. I think you've said a lot of technical and scientific things there. So I'll try to bring you back so that you can at least speak the language that we can try and understand. When you say RNA, what does that mean?
Ribonucleic acid.
Sorry?
That's a ribonucleic acid. That is for in genetics, if we say DNA, deoxyribonucleic acid, that's the structure, the gene structure. This RNA is, yes, ribonucleic acid. It is a strand which now interprets the genetic information from the DNA and then in the cell so that it's utilized production of proteins which are needed in formation of something, an organism. Okay. That is the RNA for genetic coding. Okay.
All right. No, that's fine. Thank you so much for giving us that explanation. Now, you mentioned again another sad thing to actually hear, and that is when you say that there's no proper guideline. When you say there's no proper guideline to ensure that of how the treatment of COVID-19 should go, if you would be if you would have an opportunity to interface with the Ministry of Health, what would be your advice as health practitioners? What sort of guideline should be in place right now for the treatment of COVID-19 patients?
I think for first of all, we should take it as simply a flu, so that even the home remedies which have been used all along can be used by everyone who wants to use it. And then some vitamin supplements should be there. Very bad ones should have an added antibiotic. But at the top, prevention is better than cure. The people should have the vaccine. Almost everybody should have access to the vaccine because that is the hope. Most of the viral infections, we use vaccines to prevent that, so that your body is primed to defend itself against the virus. That's, I
Right.
think, that will the ministries.
Okay. And we have a society that has started by dismissing the COVID-19 vaccine because of the different news and information that we've had, the issue that it alters the genetic makeup of a person and stuff like that. Now, should this vaccine come right into Zimbabwe, do you not foresee, as medical practitioners, facing opposition, facing resistance from the public?
Yeah, even in the rural areas, I have heard that people are misinformed. Those are conspiracy theories. For us who have been in the game for a long time, vaccines are the real primary ways of controlling these viruses. It's an old thing. This issue of change of the genes, this and that, people should learn to trust their institutions. We have got our medicine control authority. I'm sure it could be the best one in Africa. The one, our Zimbabwe one, would be the best one in Africa. And the first, and then two, we have got universities. These universities do research. And when they say things are okay, that's fine. We have got the capacity to check on these vaccines. So it's just a fear from nowhere, from people who have not done, who have not studied the genetics itself and have not studied the history of vaccine. They have not studied medicine to see how these vaccines work.
But can you blame us? Can you blame us when we have not really had this health education in terms of the COVID-19 virus, the variants that we hear are coming on board, and the ones that you alluded to? We have not really been given information that we feel we can actually trust. The numbers, for starters. There was a conspiracy theory from the onset in March of 2020, where there was arguments that we actually didn't have any COVID-19 cases. And the moment that funding was said to be available somewhere, we began to recognize cases. Now, what sort of health education needs to take place in the communities and in the rural areas in order for people to understand what COVID-19 is and why it's important, if the vaccine should come, for us to take on this vaccine?
Zimbabwe, we are a very lucky country. Post-independence, we have got people structures like the party structures, NPF structures. So through those structures, people can be influenced to accept it. Now we have got MDC structures. Through those structures, people can be influenced because they trust their seniors. Now, if the government put its credit has got structures in the Ministry of Health, right from Central Hospital right down to the clinics, we have got a Department of Health Education, we have got departments led by community sisters. They can actually disseminate the correct information. What the Ministry of Health has to do is to lay out and put a proper proper wording, so that we can send it to the people. Okay.
All right. All right. And right now we actually don't have that. What we know is what we have seen on social media, what we actually listen to on international media. Have you recorded any cases in Chinhoyi, and how has the response of the province been?
In Chinhoyi, at Chinhoyi Provincial Hospital, that's where we started the testing. Now we have got testing in the private labs. We have got PSMI lab, we have got Lancet lab. They are doing testing in the privately. And I have seen personally about 10, and 2 of them were admitted the isolation ward in Chinhoyi, and the 8 of them, we are treating them at their homes. They are not very serious. So in Chinhoyi, the disease is there. We still have another clinic which is reserved. If the condition gets worse at the hospital, they can spill over to a clinic at Mzari Clinic, which has been earmarked for that. So Chinhoyi is prepared for whatever the disaster, for anything. We have got the quarantine, the isolation 2, isolation 7. And now people come to our institutions, they request for the test. So people are not aware. Anybody who develops a flu will come, can have a test, they go and pay the private. Unfortunately, people afford the less sensitive test, the antigen test. They can't afford the PSR, because the PSR costs $60. That's a hindrance. If it were possible for people to have
The
access,
cheap one, doctor, the cheap one, how much is it going for?
$60, this is $20.
Right,
The
but
cheap
we
one
are
is
told, government, we are told that there shouldn't be any charging of the COVID-19 vaccine. Dr. Ruth Laborde came out, is it a few days ago, saying that there should not be any charges on the testing for COVID-19.
these are, I'm talking of the private laboratories.
I see. Okay.
At the hospital, people are not charged, it's for free. But you
I
see, with congestion, people prefer to go to private institutions.
Right, right. Thank you so much. If you're just joining us, my name is Yvonne Muchaka, and on the program, I have Dr. Peter Mataruse. He's from Chinhoyi. He's a medical doctor, and we just needed to have a few understanding of what medical experts now know about COVID-19. It's actually quite sad that Zimbabwe doesn't have a protocol right now of how we should be treating COVID-19. Now, tell us a little bit more about ivermectin. I'm not too sure if I code that correctly. The medicine that we saw earlier on being given the green light to be used as part of treatment for COVID-19 patients.
Yeah, from the literature, they say it's quite effective. Both as a prophylaxis, give it prophylaxis, that is prevention, and both as curative. They say it reduces the viral load in a person, and it reduces the time period, the disease process. Instead, if one is given within 5 days, they will be okay, instead of getting sick for 3 to 6 weeks in some cases. So they say it's quite effective. But at the moment, like I said, our universities and our medical control council, it has to check whether this drug is effective to us, Zimbabwe. We have got the capacity. At the moment, as I understand, they have said can use it, but they are at the moment researching, doing trials to see whether it's effective to us. I'm sure after that they will then freely give it to the people.
Right. And we have seen that. Sorry, I'm just getting a little bit of feedback. We have seen that government has opted for China, the Chinese and the Russian COVID-19 vaccine. As medical practitioners, have you had a look at the different vaccines that are on the market, and what is your view on these two particular vaccines that government is eyeing?
I don't think there's anything wrong with using those vaccines. It's a question of the preference, maybe the deal itself in terms of price, this and that, and otherwise, to me, I don't see problem with getting vaccinated because when they come, we still test them, whether they come from USA, they come from UK, from whatever country. When they come to Zimbabwe, we do test for their efficacy. So it doesn't matter where this vaccine comes from.
Okay. All right. So does it mean the testing is done before bulk purchases, or the testing is done after the bulk purchasing has been done?
It should be done before the bulk purchasing. They come here, they do their trials, and then when they are convinced it's effective to us, then they come.
All right.
They fail.
All right. Thank you so much, Doctor. You had given me 20 to 30 minutes, so we are 21 minutes in. Maybe if you've got a message to the people of Zimbabwe, is this virus really there? How should I keep myself safe? People in Zimbabwe, generally, we don't like the hospitals. As long as we are fit, we can move. We don't like going to the hospitals. And there's this COVID-19 that is making rounds in our societies. And really, people don't like being tested, in essence. Now, what would be the advice that you give to the public as we face this global pandemic, besides staying at home? Because most people are doing that, but people are also trying to find ends meet in order to survive. So, what is the message that should get into the psyche of an individual as they go about their day concerning COVID-19?
First of all, people should understand that this is a flu virus, and maybe 80% of people don't develop symptoms, whether they are exposed to it, they don't develop symptoms. Then a few will develop mild symptoms. Then very, very few people will develop the disease, the COVID-19 disease, the severe respiratory syndrome. So people should protect themselves from everybody. People should assume that everybody is a potential of having the condition. So social distancing should be a priority. And then two, people should wear a mask in crowded areas. Those are two major issues. And of course, I'm not going to mention, it would be nice to stay at home to make sure that you don't mix with, you reduce the chance of acquiring the disease. And then when one gets the disease, it would be nice to self-isolate if you have got a flu, so that you don't give others. And then do the normal home remedies. You see, you get people use, because Zimbani, they use the guava tree, and that alleviates the symptoms of the condition. And if it gets bad, you can visit your GP, you add some vitamins, you can have some zinc supplements, you can have, if you lose appetite, you also give some multivitamins. Most of them develop headaches, you give them painkillers to relieve symptoms. So that's the advice I will give them. And when the vaccine comes, please take the vaccine. Don't be fooled that they will be vaccinated so that you don't reproduce, this and that. Those are conspiracy theories. Our institutions will give us safe drugs. Thank you.
All right. Thank you so much, Dr. Mataruse. I'll let you get back to your business. Thank you for making time to speak to us.
Okay, thank you very much.
Awesome. All right. So that was Dr. Peter Mataruse. He is a medical practitioner based in Chinoy. He is also a member of parliament and a member of a health committee or something. So we're glad that he could join us right here on Zimbabwe Daily to give us the medical aspect of the COVID-19. So a number of issues that he clarified for us, the issue that there are different coronaviruses that have made rounds, and that there are different variants that have been making rounds in our systems, and we also got a diagnostic of what happens when you get the flu and all of that. And yeah, I would advise you to just go through the interview that we just had. COVID-19, guys, is real. We have had so many positive cases recorded. I'll just give you a brief statistics from the alerts that we are getting on a daily basis. So we have on the 27th of January recorded 300 new cases, and we had 19 deaths. Cumulative cases come to 32,304 positive cases recorded. We had 23,687 recoveries. Cumulatively we have 1,122 deaths. Do make sure that you have the emergency COVID-19 toll-free number 2019, and yeah, we get this information from the Department of Civil Protection. Let us make sure that we keep safe and we mask up. We need to wear our masks correctly. Guys, we really need to do this. We must cover our nose, we must cover our mouth, we must sanitize with hand sanitizers, and we need to make sure that we stay at home where it's possible. This thing is here and it is here with us. We don't know how long, but the best we can do is to prevent rather than cure. So make sure you keep your vitamin C, and then you take on the flu home remedies, miguava, zumbani, etc., etc. And when you get sick, make sure to visit your health centers in order for us to fight COVID-19. Thank you so much for joining me on Zimbabwe Daily. It has been a pleasure being with you this afternoon. Have yourselves a wonderful rest of day. And as we get into the weekend, let us enjoy responsibly, even as we do so in our homes. Thank you so much, and God bless you.